So now I'm going to demonstrate how to insert an IV cannula. First, you want to make sure that all your equipment is next to you and ready. So I have here IV cannula, the 10mm syringe, 10mm of normal saline, extension tubing, tegaderm, tape, sharp spin, swab, and a tourniquet. Now I want to prep the tape for when the cannula is in later. So I'll make sure I get that ready and not on the sharp spin. Once that's done, I'll just make sure all my other equipment is ready so that I'm not delayed later on. I'm going to need a flush later, and I'll need to prime the extension tubing. So I'll prepare this. Close the tap to ensure that there's fluid in there and no air, all while keeping aseptic technique. Okay, extension tubing is ready. Now I will put the tourniquet on tight enough so that I can get a better view of the veins, but not too tight that I remove circulation. When the tourniquet is on, I'll check for a radial pulse to ensure that there's still circulation, and once that's confirmed, I'll swab the area in which I choose to cannulate. As that dries, you can get the cannula ready. And once that's dry, you get yourself ready to cannulate. Sharps out, anchoring the vein, ensuring you come in not on an angle that's too high and not too low. And just going in deep enough until you feel that pop that you're in the vein. Level it out and advance the cannula. Ensuring not to take the needle out fully until you've occluded the vein and released the tourniquet. Sharps out, sharps away. Normally the sharp spin wouldn't be as full as that, and if it was, you would be making sure it's emptied or changed. This has been prepared earlier. It can be inserted. Once that's on, you now have no blood spitting out, and you need to anchor the cannula onto the patient's arm. Stick the stick the tegaderm onto the plastic part of the cannula to ensure that, if needed, you can remove the extension tubing. Once that's on, get the tape that was prepared earlier and begin to anchor it. That way the cannula will not be removed, and when you've got that way this doesn't get in the way and you have some movement as well. Okay, now that the cannula is on, I want to flush the cannula to ensure that it's in. Making sure that the tap is open in the direction that you want the fluid to go. See how that's open there, that's open there. This is blocked, but alternatively I can have the tap facing that way so that this is blocked completely. And flush. And normally when the cannula is in an arm correctly, the fluid will flush and go through.